COVID-19 is in our communities and the number of cases is on the rise. So it's essential that we each play our part in full by following all of the government guidance. Only by doing this can we keep our schools and businesses open. If you're young and healthy, you may feel the virus isn't a threat to you. But someone more vulnerable to coronavirus than you, perhaps someone closer to you than you realise, is depending on you to play your part in breaking the chain of transmission. So I'm asking everyone to do their bit. Stick to the rule of 6 for gatherings indoors or outdoors. Wash your hands thoroughly and regularly. Wear a face covering in enclosed spaces. Observe social distancing of 2 metres or 1 metre plus precautions where 2 metres really isn't possible. Follow all of the guidelines about car sharing. If you have symptoms, self-isolate and get a free test immediately. If we work together on this, we can control the spread of the virus. Thank you. Hello, my name's Jonathan Gribbin and I'm the Director of Public Health for Nottinghamshire, and I lead the county's response to COVID-19. None of us want our children to miss out on all of the benefits that school brings. So I want to let you know just how hard our schools have been working to ensure that they've all got in place the sensible precautions to receive back pupils at the start of the new year. But of course, all of us need to play our part in stopping the spread. So alongside the guidance you know about already, I also want to urge you to follow the guidance on safe travel to school. Please walk or cycle, or if a car journey really is essential because you live more than 2 miles from school, please arrange drop-offs well away from the school itself. You can find out more details about this and about all of the other government guidance on our website. If you've any questions about plans or arrangements at a particular school, then the school itself will be the best place to answer them. Thank you for watching.
Thank you. I'd like to welcome you all to the policy meeting, which is being held remotely. I'd particularly like to welcome Stuart Young, East Midlands Councils, and Miriam Duffy of the National Rehabilitation Centre, who are here today for items on the agenda. And they are 4 and 5 respectively. For the benefit of viewers live stream, I will now ask the clerk, Keith Ford, to list the members and officers present. So Keith, please.
Thank you, Chair. I can just confirm that we have, as well as the leader of the council, Mrs. Cutts, we also have Councillor Reg Adair, Councillor Chris Barnfather, Councillor Richard Butler, Councillor John Cotty, Councillor Kate Fole, Councillor Stephen Garner, Councillor Glyn Guilfoyle, Councillor Kevin Greaves, Councillor Tony Harper, Councillor Richard Jackson, Councillor John Knight, Councillor Bruce Lawton, Councillor Rachel Madden, Councillor David Martin, Councillor Philip Owen, Councillor John Peck, Councillor Mike Pringle, and Councillor Muriel Wise. And we also have Councillor Jim Creamer on the line, who is here for agenda item number 9, planning for the future. As well as myself, we also have the following officers present today. We have the Chief Executive, Anthony May. We have the Monitoring Officer, Marge Toward. We have the Chief Finance Officer, Nigel Stevenson. Corporate Director, Adrian Smith. Service Directors, Derek Higdon, Matthew Neal and Marion Clay, Group Manager Neil Gamble and Andy Evans. Thank you very much, Chair.
Thank you very much, Keith. So the minutes of the last meeting then that were held on the 16th of September, that's pages 5 to 10 on the minute book. Do you all agree they're a true and correct record? I'll take no comment as being an agreement. Thank you very much. And do I have any apologies for absence, please?
Chair, we have apologies from Councillor Alan Rhodes, and Councillor Kevin Greaves is attending in his absence.
Thank you very much, Chairman, and welcome, Kevin. Declarations of interest by members and officers, that is a disclosable pecuniary interest, both private and non-pecuniary, and that's members and officers. And does anybody have any to declare? No, thank you. I'd now like to introduce Stuart Young, who's the Chief Executive of the East Midlands Councils. Stuart's kindly come along today to give us an update of the work of the East Midlands Councils. This is very important to our region, where this is the point where all councils come together and we have an opportunity to discuss things which are mutually interesting to us all. So without further introduction, Stuart.
Thank you, Chair. Thank you for the invitation. And thanks all for your time today. I really appreciate how busy you all are at present. Now, the report is before you and I hope the update is helpful. There are a number of areas that I'd like to focus on and of course provide further details as events as ever move on apace, and that's moved the issues along somewhat. But before updating on the programme areas, I'd like to first focus on some observations of working with the sector over the past 7 months. It's difficult, I think, to find adverbs or adjectives that sufficiently describe this time, but suffice to say, it's been rather challenging. I'm best placed, I think, to offer comment from an East Midlands perspective. And here I think the sector should be congratulated. My report refers to local government as a beacon of sound planning and organisation. Officers and members aligning and working in genuine partnership against an extraordinary public health emergency. And I'm proud that my organisation, East Midlands Councils, has played a role. And of course, as a sector and of course, as an organisation, we haven't got everything right. And we'll learn from that. But in the main, I think we've demonstrated the strength, the capacity, resilience and the responsiveness, and fundamentally the ability to deliver on behalf of the sector. And that's why I think the sector should be congratulated. Turning to economic growth and infrastructure, if I may. Despite COVID, in some respects, it's been business as usual because these areas of work need to continue to be worked upon. We know that the national economy has taken a massive hit, but I think the effects on the national, but the effects on the local and the regional economies have yet to fully work their way through. But I think the likely impact is going to be severe on those areas, or likely to be severe on those areas already disadvantaged by a low economic activity rates, low levels of social mobility, low employment and low income. And it's this, I think, that places into stark contrast, or stark focus rather, the importance of the levelling up agenda. You know, some really important work that we need to focus upon. Also put into stark focus, the importance of this is the recent Treasury statistics referred to in the report that highlights or confirms the continuing and worrying trend or low levels of investment into the East Midlands. Now, that's context. On a more positive note, in terms of how we're responding, a more positive note is, has been response highlighted in the report, not least in regard to HS2, where the collective approach has been strengthened and increasingly recognised by ministers. We're seen as credible partners, and importantly, partners that present ambitious, investable proposals. So please do not accommodate those, whether in Westminster or Whitehall, that say we don't have a commonly agreed set of investable proposals. We do. And I think in the case of HS2, there's a real strength there because it fits with the National Infrastructure Commission's fiscal mandate, and that's highlighted in the report, in effect, the financial envelope. I'd also like to refer members to a real success, a first for this region, and a first nationally, actually, in terms of the new model. We've secured Dft Funding in support of our work with the East Midlands rail franchise. Dft have put together a 10-year funding commitment, and that's been matched by local transport authorities, including Nottinghamshire County Council, and that allows this region to have a direct input into the management of the rail franchise. And importantly, it aligns really well with the Williams Rail Review, the changing nature of how we structure the rail industry in this country. I note in the agenda and papers today that you have an item on the planning white paper. Now, planning for growth. It's a matter of real importance for the sector, for local authorities, and at last Friday's East Midlands Council's Executive Board, members were clear that EMC should respond to the consultation currently being undertaken, and this response, to reassure members, will be undertaken in full discussion with local authorities across the region, and we just need to focus on those key areas of opportunity, but key areas of concern that local authorities may have with the proposals as they move forward. Turning then, if I may, to asylum and refugee resettlement, there are two main issues I'd like to focus on and to update members. One is upon asylum dispersal, and one is on the resettlement of unaccompanied asylum-seeking children. Now, asylum dispersal, there's been some significant changes over the past 7 months. At the one side, you will see over the past few months, in part caused by the pleasant summer weather, there's been an increase. There's small boats referred to in Dover and the Kent coast. So there's been an increase in the numbers seeking asylum in this country. But alongside that, there's been a fracture of the system, in that it's been termed a stay of move in and move out. So in effect, nobody's been able to move out of the asylum dispersed accommodation, and nobody's been able to move in for quite obvious reasons. But what that has done in effect is there's been no flow through the system, and the increase in numbers has continued to increase. What we've seen in this region is an increase of contingency accommodation, as it's called. What we have in effect is an increased use of hotel accommodation that everyone will agree is far from ideal. It's far from ideal for the people themselves. It's far from ideal for local authorities, local areas, and it makes the management of some of the implications from asylum dispersal more challenging, perhaps, to deal with, not least around the extra work around health support services, and including that the extensive work that's been undertaken by local authorities and the Home Office and Serco in terms of COVID management. And actually, as a region, we've undertaken quite a lot of work on that, just to make sure plans are in place. But our primary concern around contingency accommodation is the increasing numbers. They can continue to increase, and it was first highlighted that it'd only be temporary in nature, but it first started to be used over 18 months ago, and I think after 18 months it ceases to be temporary. Part of the solution is looking for an increased provision of asylum dispersed accommodation. In effect, a number of authorities that are willing to participate. Now, it's not our role to lobby or to persuade. It's our role, EMC, to make sure that local authorities have all the information in front of them to enable them to take an informed decision. So we've been working with authorities across the region, just making sure that they're aware of all the implications of asylum dispersal and some of the issues that the Home Office need to take on board to enable local authorities, if so minded, to take that step. The other big area is around unaccompanied asylum-seeking children, partly associated with the increase in numbers in Kent, but also associated with some of the problems building within the system for some time. On a positive note, and I'm really pleased that EMC and local authorities in this region have taken the leading role here. There's been an increase in the level of funding for care leavers or UASC care leavers, and also there's been the launch of a programme in the East Midlands. Actually, the formal launch is today, to increase the capacity in the foster care market and also supporting lodgings. Local authorities put together a joint application and drew in nigh on £800,000 into the region to enable an increase in the foster care provision. That's a really good example of joint work, and it's part of the solution to addressing some of the concerns with UASC. But the main issue I wish to highlight, and I want to thank Councillor Owen and also Colin Pettigrew for their work on this, is around the consultation on changes to the National Transfer Scheme for UASC children. Now, we've been robust. We put together a comprehensive response. It's been pragmatic, highlighting the potentially counterproductive implications of the proposals, and also alongside that suggesting how actually there are alternative options that we'd like the Home Office to explore, not least concerns around the arbitrary figure of 0.07 of the local rate, rather than using actually the commonly accepted rate that's the numbers of looked after children. So there's been much work on UASC, and actually that's been led by local authorities in this region, and I'm truly grateful for all their efforts. And if I may, Chair, just to close, just to focus on some of the wider EMC support work to the sector away from the programme and the policy work. Now, since the onset of the pandemic, we've had to change our approach. The work programme that we put together in February has changed significantly. Alongside our change of approach and the new programmes that we've put together, I'm really pleased at the way it's been rolled out. And I'm really pleased at the way the local authorities have been able to take part and participate in that, as they've taken a new approach to the new virtual world of working. There's a couple of great examples I'd just like to highlight. One is the work that we undertook with you a couple of weeks ago in support of yourselves, the Virtual Recruitment Assessment Centre. Now, this is really good because the number of shortlisted candidates, we worked with you in terms of managing the programme and pulling the successful candidates through. And it's a really good example where local authorities can take an active role in their local communities in providing opportunities for young people in their local area. And we're taking that as a really good example of what other local authorities could do. And I'm really pleased that EMC was asked to play a role in that. We're running a number of events, seminars, workshops for members and officers. There's an event coming up that the timing's certainly fortuitous. I will put it down to foresight, but it's on regulation and enforcement, increasingly important given the new rules, regulations and laws. There's now over 140 registered participants from local authorities in this region on that event. And that's the sort of thing that we should be doing, because we appreciate local authorities need to be able to work together and jointly discuss the implications of some of these new rules, responsibilities that are being passed down, and local authorities keep on stepping up to these new responsibilities placed upon them. We regularly work with chief executives from both tiers, from across the region, in effect weekly meetings. I've mentioned a number of CPD and the events and seminars. I'm very pleased, and we've benefited from the work of Peter Marks, the regional convener on COVID, able to work with universities in putting together preparatory plans with regard to the return of students. And I think the news elsewhere shows how important that work has been. And just to close, I've just put in the report just some information in terms of the work that we've undertaken over the past 12 months. Now, EMC's subscription base is less than a third of our total income, and that's the way it should be. We pull in over a third from low-cost consultancy, heavily discounted for our member councils, and we also pull in grants and contracts from central government. Apologies, I can't mute that phone. Now, the good side is every year, once a year, I see the level of participation from local authorities in the region. Every local authority is using our services, and I've just listed them, over 60 assignments undertaken over the past year. And if we was to monetize, which I appreciate is a dreadful phrase, but put a figure on the level of savings that we've generated on behalf of the sector in the region, it's at around £730,000, which I think is a good reflection of the work that we do. But it's only a snapshot, because much of the work is difficult to put a figure on. But we're only able to do that because due to the contributions and support of local authorities in the region. Thank you.
Thank you very much, Stuart. Well, before I throw this open for debate, I'm presuming you're happy to answer questions, Stuart, but I need to make the recommendations now. So I'm going to propose that we consider the information and decide if there are any further actions required. And 2, agrees to receive a further update to a future meeting. Do I have a seconder for that?
Yes, I second that and reserve my right.
Thank you very much, Reg. Who would like to speak to this paper? Muriel, got your hand up first. I've got Muriel and Kate Fole. Can you unmute yourselves? We can't hear.
Yeah, my apologies.
It's all right.
I won't do it again, hopefully, during the whole meeting.
Yeah.
Yes, particularly in relation to paragraph 418, in relation to unaccompanied children seekers. That is encouraging. I'm just wondering what arrangements being made for children during the restrictions of COVID, and how are we tackling the difficulties of linking unaccompanied children to their families in the country? There seems to be sometimes some difficulty in making that linkage, which would be positive for the children and would obviously reduce the need for other accommodation. I just wondered how large a problem that is.
Thank you. Can you answer all the questions together, Stuart? Thank you. I'd now like to bring in Kate, please. Kate Fole.
Thank you. First, I want to say thank you to Stuart. I mean, as he said, it's extremely challenging. And when you look at the breadth and the depth of the work that they do with a relatively small team, I think it's extremely impressive. So thank you. Just a couple of things that I think were really good and are encouraging. I mean, to keep plugging away at this kind of levelling up agenda is really, really important, isn't it? And I looking particularly, say, for example, at the amount spent on transport infrastructure, it's absolutely appalling, isn't it? I think, you know, to keep plugging away at that as well. And I'm glad that you're thinking of a response to the planning consultation. I think that's really good. And to share Muriel's concern, I mean, one of the things more broadly, I think we know, is that the number of referrals to multi-academy safeguarding hub of children's safeguarding has gone down significantly, and I think we all know that that's not the real picture. And add to that the unaccompanied asylum seeking children, the cost of children in care and coming out of care. This could be really, really big and difficult, couldn't it? So I think the partnership working is really good, but I think again we need to keep plugging away and away and away at making sure that we keep our children, we know who the children are, and we keep them really safe, and I think that's really important. Okay, thank you.
Thank you, Kate. I now have David Martin.
Yeah, thank you, Chair. Yeah, I mean, I read the paper with interest, and thanks for your update, Stuart. And I did come to an East Midlands Council meeting a couple of years ago, but I'm still horrified at the sheer imbalance of spending in the East Midlands. It really horrifies me. And they also constantly prevaricate about electrifying the Midland Main Line. You know, I mean, surely the East Midlands area is successful without this funding. Just think what it could be if this balance was redressed. You know, we're consistently 33% behind London, consistently for 6 years, over 2 governments. You know, I mean, what is the problem with them? Why are they? Can you answer me? Why are they not supporting this area? I mean, I have a railway station in Kirkby where there's no disabled access. If you're disabled, you can't get on the train. We have simple infrastructure projects all across the county and across the East Midlands that could be supported by this funding stream that are just it's clearly not happening, and that is my real big issue. I really fail to see why they persistently and consistently underfund our area. And HS2, when we talk about HS2, we're definitely going to Cheshire. We might be going to Leeds. We might not be going to Leeds. We might be going to Leeds. We might not be going to Leeds. It's a constant. What is it? What have persistent governments got in their bonnet about the East Midlands area? That's what I really want to know.
Thank you. Rachel, have you indicated you'd like to speak? Rachel Madden.
Yes, thank you, Chair.
Thank you.
Firstly, yes, thanks for this comprehensive report and keep up the good work. I can see from week to week what you are doing within the EMC, so keep it up. Ongoing disappointment, of course, about the non-electrification of the rail line, etc. But I note there's an article in the Independent today about joined up travelling across the Midlands, and it's suggesting the use of a single traffic card to access public transport from Birmingham to Nottingham, which includes the whole of the West Midlands. Here we go, East Midlands out of it, Leicester and Derby. Now, I wondered if the EMC did have any input, any contact with those sort of discussions, etc. The Nottingham City Council leader has welcomed this, but it seems a shame if it's not being doled out to Nottinghamshire. The government are being extremely good in giving Kirkby and Ashfield millions of pounds for an upgrade, but there's not much point if we can't access it properly on the rail lines, either through accessibility, as Des has highlighted, or the fact that we have to keep buying different tickets or whatever. In Ashfield, we have 3 forms of transport: the tram, the bus and the train. Having a smart card, as I say, did you have any input in this? Could you pursue this at all? Thank you.
Thank you. And now I've got Bruce Lawton here. You're the next speaker.
Thank you, Kay. You shouldn't have mentioned universities. Just to really make a point, a lot of my residents are getting really sick and tired of their loved ones ending up at university and not receiving an education, and on top of that, burdening themselves with debt. This is on the back of the fact that many of the university lecturers have been on strike before that, and they perceive, in fact, I think, and I agree with them actually, that they are not receiving the service that they are paying for. So while you're talking to the universities, you can explain to them that people are getting really sick and tired of the way that they're being treated by the universities. In some cases, they've actually been asked to attend their universities and then been told that they're on a reduced timetable or no timetable at all. Thank you, Leader.
Yeah. Right, are there any more questions, please? Well, I hope you'll be able to take a note of all of those, Stuart. Would you like to answer some of them? Things that are not in your report, of course, you're not obliged to answer.
Thank you. I hope I'll be able to cover it. If I miss anything, please let me know. in relation to US, the issues there and management of COVID, it has been obviously a real concern. Reassuringly, local authorities have been quite clear and have had good opportunity to inform how COVID issues are managed with colleagues at the Home Office, particularly through DPHs and their oversight. And it's particularly a local issue, and I actually think that local authorities themselves individually have managed this well. There have only been a limited number of transfers. They have stepped up somewhat since the as the crisis in Kent has deepened. But generally, many of the COVID concerns have been managed quite well. I think our primary concerns are in relation to the adult asylum dispersed cohort, because, well, they're housed together in, say, hotels, and you're talking about occupancy of a couple of hundred, and that's where there is a potential risk. And in terms of, you mentioned about reunification, much of this is responded to government policy and direction, and we've worked quite a lot on, it's been called the DUBS and the Dublin 3 reunification. Now, in effect, that programme has now been largely completed, and we're now focusing much more on the transfers, the spontaneous arrivals that tend to arrive in Kent at the moment. We have done really well, and I say we, local authorities, have done really well on managing the DUBS and the Dublin 3 reunification cases. In terms of the levelling up, if I take Middle and Mainline Electrification first of all, I think we all know this should have been done 30 years ago. There's clear consensus in the East Midlands that this is at around the #1 investment scheme. Now, there was a clear barrier in DFT, and the previous Secretary of State clearly was of a different view. I think the approach has softened somewhat, and we are almost. Our approach at the moment is incremental electrification, and it's linked to HS2. If you want some of the benefits of HS2, part of the line needs to be electrified. And I think the situation may well arise in 10, 15 years. We hope to have the line as near as damn it electrified, and we're going on that incremental approach. And it's clear where the benefits are for electrification. And the proposals are very simple, and the benefits are very clear. Linked to the figures around levels of public investment in the region, yes. I think the phrases, they're horrific. They are. And actually, it helps us present the figures back to Treasury, because these are irrefutable figures. These are government-owned figures. What we need to do alongside that is present the investment proposals. I think that's where our weakness has been. It will take a while to bed these proposals in, but I think if you look at our proposals that we worked with Midlands Connect upon, our proposals that we worked through HS2, and our proposals that we worked through with Transport for the East Midlands, just to name 3 routes to market, I think there's a real there's a real set of investment proposals, investment ready, and we need to push on that. And I've been really, it's been pleasing to see how local authorities and the business sector are pushing together on these. In terms of Midlands Connecting, you mentioned the smart ticketing proposal. I've just had a look at the news coverage. I think it's, I think there's a shadow of the West Midlands. It's been presented, there's a concern this is a West Midlands proposal. We've been pushing for this through Midlands Connect, because we know that the east-west connectivity is really poor and the ticketing system is very fragmented. What we're trying to put in place through this is the smart ticketing, single tickets, whatever you call it, but an ability to support east-west travel far better and far more seamlessly than the current systems allow. So it's a good proposal. We just need to make sure that as a region, as local authorities in the East Midlands, we maximise our benefits and opportunities, and it isn't seen as a West Midlands proposal. And so it should be of benefit for the East Midlands. Hopefully I've covered the issues raised by members. Is there anything that I missed, Chair?
I don't think so, Stuart. I think you've done very well there. Thank you very much indeed. Certainly very interesting. Now, Reg, you've reserved the right to speak. Is there anything you would like to add to this?
No, I think most things have been covered as we go along, and it's all in the report there, so thank you, Stu.
Yeah, I entirely agree with you. I must tell you, we are, as this council, it belongs to the HS2 group. I chair the HS2 board and also the Totem board. We have full agreement there of our way forward for HS2. It hasn't been on-off, as you've suggested, David. It's always been supported by ourselves. And when the government looked at it, they supported it also. It actually is a missing piece of railway line, joins the Leeds to the rest of us and Birmingham as well, before we join the East Coast line again. And it is, I think, an important piece of the railway system that should go ahead in any event. We're also members not only of East Midlands Councils, but Midlands Connect and Midlands Engine. And we have fought very hard by this grouping for things like the upgrade of the 614, the A46, the A1, the Midland Mainline Electrification. And I had a recent letter from Grant Shapps, which I handed on, which is saying this is definitely now being properly considered. So I think we've touched all these bases, and by being part of the East Midlands Councils, I think this gives us an opportunity to share these with our colleagues in the East Midlands, which of course is what a combined authority is all about, because by being a combined authority for the East Midlands, we could probably draw down the funding we're sadly lacking, and it's time we all got our shoulder to the wheel on this. So I'm now going to ask the Chief Executive to call the register, call the vote. And so, Chief Executive, could I ask you to carry out this function?
Thank you very much, Councillor Cutts. Just a reminder, colleagues, that this isn't a recorded vote, although of course you can request one. This is recording your vote because it's easier when we're streaming in this way to call your names so that we've got a comprehensive list of the way that you have voted. So, starting with Councillor Adair.
4.
Councillor Barnfather.
4.
Councillor Butler.
4.
Councillor Cotty.
4.
Councillor Cutts.
4.
Councillor Fole.
4.
Councillor Garner.
4.
Councillor Guilfoyle.
4.
Councillor Greaves.
4.
Councillor Harper.
4.
Councillor Jackson.
4.
Councillor Knight.
4.
Councillor Lawton.
4.
Councillor Madden.
4.
Councillor Martin.
4.
Councillor Owen.
4.
Councillor Peck.
4.
Councillor Pringle.
4.
Councillor Weiss.
4.
Oh, there we are then, Chairman. That one just squeaked through.
Right, on to the next item on the agenda, please. It's agenda item 5. This report will update members of the work on the National Rehabilitation Centre project, and we're joined by the Programme Director, Miriam Duffy, and we're very glad to have you here with us today and looking forward to hearing your comments. Members will appreciate that the COVID-19 pandemic has affected the timescale of this project, well, particularly in terms of the consultation, because of course it's been much more difficult. But I think this project is back on course now, and I'm going to ask my colleague, Reg Adair, to propose this item since it lies in his division. So, Councillor Adair.
Thank you, Chair. Yeah, this report update is very, very important to us in this area, especially in South Knox and in my division, which covers Runnington, East Leek and all the way down to the Soar, because it's adding to the DNRC and the technologies of the DNRC. It's important from the point of view that this proposed facility, what it'll do for employment, economic growth in the area. But more important than that, with its joint working with the DNRC, we will have a world-class health and technology service in Nottinghamshire, which is very, very important as well. Plus, of course, I know there's a budget of £70 million to bring this about, so that will be also very, very important to the local people, especially around, you know, if we take Remston, East Leek and Costock and all those areas where I'm sure a lot of the employees will come from and around that border area. So it really, really is an important part, and I hope, Miriam, that you can get it through as fast as possible, and that COVID in itself is not affecting its progress and too much.
So, we're seeing all of that and the positiveness of the whole thing, I'll just say that I'll move the recommendations that members consider the latest update and decide whether any further information is required at this stage, that the committee welcomes the ongoing progress with the development of the centre and support the revised timetable, and that a further update report is to be provided to a future meeting of the policy committee. So I recommend that. Do I have a seconder for that, please?
Yes, I do, Chairman. I second that and reserve the right to speak.
Thank you.
Could I ask Miriam now if you would make your presentation or make your comments known to us all?
Yes, thank you very much, and thank you for the opportunity to come and report back on the National Rehabilitation Centre programme and for your ongoing support with that programme. So yes, as you quite rightly said, Chair, the pandemic has affected our programme of work, not unexpectedly really, and the main implication of that was to the start of the public consultation, which was obviously organised in face-to-face meetings across the region. That was conducted and closed on the 18th of September, but it was done virtually, and we had approval from Regional Committee and National Committee to go ahead with that. So we had over 750 online responses to the survey, which is a good response rate. And of those, it's looking like 75% are in support of the project, which is very helpful. We also ran 3 public forums virtually, just as we're doing today. And there were a wide range of questions there from members of the public, both in terms of the types of patients who would have access to the facility, what the facilities were, and how they would get there. So they were very good questions actually, and well informed in the main. So we are expecting the formal report on that consultation next week. That then feeds into the next stage of the business case process, which is called the decision-making business process. And that's when the clinical commissioning groups decide whether or not to commission a service through the National Rehabilitation Centre. So that's an important milestone. And that decision will be taken on the 2nd of December at their governing body meeting. The other part of that, which will feed into that decision-making process, is our presentation, which occurred on the 24th of September to the Clinical Senate. You'll remember in January, I spoke about our initial consultation with the Clinical Senate back in July 2019. They gave us 4 recommendations of areas to work on the case. So the first one of those was admission criteria. The second was our workforce plan and development. Our third was discharge pathways and how we would link and integrate with community services. And the fourth was a further piece of work on health economic benefits with getting rehabilitation right. And of course, what COVID has done is highlight the need for rehabilitation. And I think the general awareness of the impact of rehabilitation is increased in the public. So we reported back on those on the 24th of September. We had a very positive response to that. It was a whole day event again. And we really don't have any other recommendations from the Clinical Senate to work on. They were very happy with what we had done, and they did offer to support evaluating the service once we'd opened in 2024, which was very helpful, a very helpful offer indeed. The other milestones that we've carried on with the wider programme of work, apart from the clinical services, we have appointed our academic partners. We have direct partnership now with the University of Nottingham and Loughborough University, and they have in turn gained a consortium of academic institutions the length and breadth of the country. So they are in the process of working up the training and education offer and the research offer that will go through the NRC. We've also appointed our architects, and we've done a series of workshops and have now quite detailed internal layout designs for a very exciting and integrated clinical and academic space. That work is now being costed so that we know the exact amount of that capital cost of the building. And we've also in the process of applying for our section 278 for the enabling works, and that includes the road junction, the Bellmouth entrance and the access road to the site. So all in all, the programme as a whole is progressing well. We have had this slight delay because of COVID. We do have now an ambition to open in the autumn 2024 because of that, rather than the summer, but we're still aiming for 2024 to be our opening date. I'm happy to take any questions.
Thank you very much, Miriam. That's a very comprehensive roundup of the events. Right, do I have any questions, please? Muriel, yours is the first hand up.
Thank you, Jen. Thank you, Miriam, for the update, and thank you very much for the reports that have come to health scrutiny, because, and I think a report's due to come in the next week or so. So we've really appreciated the ongoing reports, keeping us in touch with the developments. I'm just interested, it's perhaps more a question for the CCG, but I just wondered this issue about there being adequate resources for local residents in terms of rehab. Do you have any anxieties about the shortfall of support between what the centre will give and what the other wards and units in the county can provide?
Can I ask you to answer all the questions together, Muriel? Okay. I have another question now from David Martin. David.
Thank you, Chair. Yeah. Yeah, obviously it's a great centre. It's a national centre, and it's going to be the state-of-the-art facility, and it really is what Nottinghamshire requires. I've got lots of military veterans in my area who have heard about it. Some have been, actually, and what a wonderful operation it is. When it comes to the new extension on the public side, I think I may have asked this question before, but I need refreshing in my mind. The actual in the rehabilitation unit, the independence of it, there's just one rehabilitation unit planned, I believe, and I just wanted you to give me confirmation on how actually realistically independent that's going to be, because when people come back home across the county or country or wherever, I need to know that facility is going to actually deliver and make people independent and not be managed, if you like, you know what I mean, by the staff that are there. So I need to know that, I need to be sure that is going to be an independent or as independent as it possibly can be in that location.
Thank you. Rachel, you've got your hand up, but I'm sorry if you haven't got a toolbar at the bottom. I noticed your hand. Please go ahead.
Thank you, Chair. Yeah, I keep clicking on the toolbar, but it keeps saying just try again, try again. So thank you for being vigilant, if nothing else. Following on from what Des has just said, thank you for this. It's good to see it's going ahead despite everything, only a slight setback, etc., and it'll be welcomed in the area. Complete coincidence, of course, that we had a Scrutiny A panel meeting on veterans and pathways. We've got a growing veterans support network within Kirkby and Ashfield and Sutton, and we were looking at further ways that the district could actually support these people. Would it be worthwhile, once things are ticking over, that there is some sort of liaison between districts and the centre, or should we just rely on Notts County Council? Thank you, Chair.
Thank you. And John Cotter, you wish to say something?
Yes, thank you, Leader. Thank you, Miriam, for the update, and it's great to see things are moving forward. As Councillor Adair mentioned in his opening piece, two of those communities are who I represent, Rempston and Costock, come right up to your boundary. And I thank in the past for the tour around the centre to see what a fantastic facility is there now. And also in my role as Chairman of Communities and Place on highways issues. I know we're working quite well, and there's one or two things coming forward at the moment. And looking forward to working with your team going forward on the new development. And also for the fact of what it brings into Nottinghamshire as well. So I'm not going to repeat any of the questions that have been ably put already, but thank you very much for coming today as well. Thank you.
Thank you. And now Kate Fole.
Thank you, Chair. Yes, this is a really wonderful centre. It's going to be, isn't it? I think it's a wonderful thing that's happening here. I was just interested, and I didn't pick up all the nuances, to be honest with you. This isn't an area I'm particularly familiar with, but you said that you would have to do some work around the admissions criteria, and that's something that I just would really like to know a little bit more on. You know, an understanding of actually what that criteria is and what the concerns might have been. Thank you.
Thank you. And now Mike Pringle.
Thank you, Chairman. Thank you, Miriam, as well. And we should be absolutely proud of what's happening with this facility. And rightly so, we should emphasised nationally, exactly like this is in Nottinghamshire. My question is, obviously, you referred to the delay in COVID, and let's hope there's not, but if there is a further national lockdown and a further delay, will that impact financially at all? And if so, are the finances covered?
Do I have any more speakers, please? No? Well, I hope you've got a note of those, Miriam, able to answer most of the questions. So the floor is yours.
I have, thank you. But again, please pick me up if I do miss anything. So I think I'll take the first two questions together, which are around shortfall and about independence. So yes, you're quite right. There is a shortfall in inpatient specialist rehabilitation beds. This will go some way to addressing that, but it won't go all the way to addressing what is in the guidance and national standards. However, the clinical model has been developed to mitigate some of that as well. So at the moment, the process is very full of delays and the patients deteriorate whilst they're waiting to get into rehabilitation. Our process is taking people very quickly out of the acute trust, so 2 or 3 days after an operation, for example, and we've built the medical model around that in the centre so that we've got 24/7 presence so that we can cover really quite acutely unwell patients in that centre, even though it's not on an acute site. So that's a really important thing for people to understand. And the earlier we can get people into rehabilitation, the better their outcomes will be. There's lots of evidence to support that. And the more intense we can provide that rehabilitation, the better their outcomes will be. So the question around independence, absolutely. Those two things will enable people to be more independent when they leave the NRC, as opposed to when they're leaving an acute bed at the moment where they don't have that specialist input and they do stay quite a long time. And at the moment, we discharge patients from hospital, as everybody knows, when they're safe to do so. The proposal is that we're not only getting people safe to go home, we're getting them as independent as possible and addressing things like work needs and wider social needs, rather than just actually being able to get physically into the house. So we've had quite a lot of commendation on that clinical model. It's very different to how we work at the moment, and it's generated a very different skill mix in the staff. And our workforce plan has reflected that. And again, the Clinical Senate were fairly impressed by that. It does follow and support Health Education England's guidelines and way of direction of travel at the moment, and certainly the 5-year forward view in terms of increasing student numbers as well. So all of that does fit together. I think Councillor Vise, you're absolutely right, though. There is a shortfall, that there will still be a shortfall, and this won't address it completely. And I think we have to be honest and upfront about that.
Thank you.
In terms of the admissions criteria, if we take that next, because it follows on nicely, actually. At the moment, specialist inpatient rehabilitation is provided predominantly for neurological patients. So people who've had a stroke, a brain injury, spinal cord injury, or peripheral nervous system problem. We've widened that criteria to not to be dependent on the diagnosis of a particular problem, but actually our admissions criteria assess the need for rehabilitation regardless of why. And we've been very clear about that. It has caused some difficulties with the CCGs because modelling numbers of patients has been harder to do in that way. But what it's meant is that a wide range of patients can access the rehabilitation beds at the NRC. So, for example, from COVID, we know that patients are coming out with lot of fatigue. They're very deconditioned, particularly if they've spent a long time in ICU. They have had quite immense rehabilitation needs actually in that acute phase. There's a wider cohort of deconditioned patients that would very much fit into that category who are existing already from an ITU perspective. Another example would be for orthopaedic patients who, particularly for younger patients, just simply don't have anywhere to go at the moment, but their fractures can be such that they are very debilitating and impact greatly on their quality of life. So they're just two examples of many actually that will now have access to the rehabilitation inpatient specialist skills that they don't already. So in developing the criteria, we really focused on how we identify that need and how we capture that and how we prioritise the right patients. And there are a number of scoring mechanisms already in use that we've brought together to develop quite a robust system. But we've also developed a system of trusted assessment so that we are skilling senior clinicians up to assess those patients in a really bespoke and appropriate way. But that assessment is then trusted down the line, and people take that on board rather than having to re-engage with that process. So there are, again, two quite new and novel ways of approaching things, and will require quite a lot of training and education for the staff as we go forwards in the next few years, ready to opening. But we really feel that they present a really robust system to getting the right patients into those beds. So I hope that answers that. And I think in terms of veterans, obviously veterans will be part of this cohort of patients, but not all. And yes, absolutely, any links with districts and other organisations absolutely would be helpful.
Well, Miriam, thank you very much. You've dealt with those questions very ably, and it is certainly going to be a useful addition to the rehabilitation of people that live in the East Midlands and wider than that. So we are very pleased to have this in our county and recognised as being in our county. Reg, you proposed this. Would you like to add anything to this?
No, I think it's all been well and ably responded to now. I know there was a bit about highways there, but I think Nottinghamshire Highways are working with you to solve that problem, and I think that's a positive as well. So what the key thing is that we're all looking forward to 2024. So do challenge Miriam, but 2024.
But on that note, thank you very much. And I now ask the Chief Executive please to call the register of how you're proposing to vote. So, Chief Executive.
Thank you, Chair. Before I do, I'm conscious that Councillor Pringle asked a question about the budget and whether a further outbreak of COVID might impair the budget planning. I can pick that up, Miriam. So we're working really hard, Mike, Miriam and I, with the National Steering Group and also potential other funding mechanisms to try and smooth any impact on the overall financial envelope. The truth is that £70 million that we've got from government has been, in quotes, in the bank for a couple of years now, and at the same time inflation and other costs have impacted on the programme. So it was never going to be enough to build everything if we include the clinical and the education and research elements. So we're actively fundraising now through public channels and soon private channels to examine other avenues for support, and we'll try and include in all of that any delays in the programme. No doubt Miriam can update colleagues about fundraising and efforts to close the gap at future meetings. And then finally, to pick up Councillor Cotty's point about highways, I'd like to thank Adrian Smith and Gary Wood for the work that they've done in recent weeks to iron out any last minute wrinkles in the planning around the entrance to the centre and the impact on the highways network. They've worked really hard and very quickly, despite all the other COVID pressures, to come up with a resolution which I think suits all parties. Now, if I may, Chair, Councillor Adair.
For.
Councillor Barnfather.
For.
Councillor Butler.
For.
Councillor Cotty.
For.
Councillor Cutts.
For.
Councillor Fole.
For.
Councillor Garner.
For.
Councillor Guilfoyle.
For.
Councillor Greaves.
For.
Councillor Harper.
For.
Councillor Jackson.
For.
Councillor Knight.
For.
Councillor Lawton.
For.
Councillor Madden.
For.
Councillor Martin.
For.
Councillor Owen.
For.
Councillor Peck.
For.
Councillor Pringle.
For.
Councillor Vice.
For.
Thank you, Chairman.
Very much. That was everyone in favour. Thank you very much. May I thank you once again, Gillian, for joining.
Thank you.
Okay, you're muted.
So sorry, I switched it off with the Chief Executive's calling, so the background noise isn't there. I was saying thank you very much to Miriam for her contribution today and look forward to a further report. So my apologies. Thank you, Reg, for the reminder. Right, I'm now going to move on to agenda item 6, which is the report of the Chairman of the Policy, Children and Young People's Committee to Policy. and the Nottinghamshire Special Educational Needs Disabilities Policy. And as this lies in Philip Owen's area, I'm going to ask Philip to introduce this. It's been through your committee, Philip, hasn't it?
Yes, thank you, Leader. That's correct. Yes, the report invites the Policy Committee to approve the Nottinghamshire Special Education Needs and/or Disabilities SEND policy for the period 2022-2023. And as you say, Leader, the report has been considered by the Children's Committee on the 21st of September, where I believe it received unanimous support. The policy builds on over 30 years of learning and best practice in the county and confirms the council's continuing commitment to inclusive practice. The council's inclusive approach ensures that most children and young people with SEND receive their education in local mainstream settings and access resources without the need for an education, health and care plan. In recent years, the SEND landscape has changed significantly, and this policy has been developed with the council's key stakeholders, including parents and carers, in response to these changes. The situation is that there are now more children and young people with SEND. The SEND needs of some children have become more complex, especially around social, emotional and mental health. And relatively new legislation stipulates that the council must now plan support for some young people with SEND until the age of 25 years. Nationally, these changes have resulted in considerable cost pressures on local authorities and schools. During 2018-19, the County Council met with local MPs and then Schools Minister, the then Schools Minister, Nadeem Zazawi, to make the case for a fairer national formula for the funding of children and young people with SEND. For the financial year 2020-21, Nottinghamshire has received one of the highest increases in its high needs budget of 7.3% or 11.8 million. But having said that, however, even with this improved level of funding, Nottinghamshire remains the worst funded local authority compared with its statistical neighbours. Appendix 2 to the report provides a summary of the feedback received as a result of an extensive consultation exercise. There was a very high level of support for the policy's vision, values and principles, as well as the anticipated outcomes. These values, principles and outcomes have been strongly informed by the feedback received from parents and carers. The policy is ambitious for Nottinghamshire and will need all partners to work together to deliver its outcomes. An action plan will be developed to ensure the delivery of the policy, which will be regularly reviewed and monitored by the Nottinghamshire SEND Accountability Board, and an update will be provided annually to the Children and Young People's Committee. I would just add one point further. There is a current internal review of SEND by the Department for Education, and the Council will need to consider the outcomes of this review, which are due later this year or early next year in the implementation of this policy. So I move the recommendation set out on page 3 of the report, which is to approve the SEND policy. Thank you, Leader.
Thank you, and I shall formally second that and reserve the right to speak. I have several people down who wish to speak on this issue. I'm going to ask John Peck, David Martin, Kate Fole and Muriel Weiss in that order. So John Peck, please.
Thank you, Chair. We do support the report and the attached updated SEND policy. I think it's fair to say that Nottinghamshire has over the past 30 years been in the forefront of developing and promoting an inclusive special needs policy where the majority of special needs children are educated in mainstream schools. I think it's also true to say, though, that the scale of ambition over the years hasn't always been matched by adequate funding, and Councillor Owen has already referred to our position with regard to funding. And many parents and head teachers and SENCOs over the years have had to spend considerable time trying to get the support that they believe is necessary for their child's integration, development and education. And I know in my time I had to spend, as most head teachers did, an awful lot of time trying to get what I felt was the right support for children in my school. As the report says, there's been 30 years of building on previous best practice. So I do think that we are in a better position now than perhaps we were in the early days. And in recent years, there's an acceptance that for some children with special needs and disabilities, special schools are the best place for them and are an important part of our inclusive provision. I think in the past there was perhaps too much of an emphasis on children should always be in mainstream schools. I know that was certainly the case in early days, but I think now we do value our special schools. When I was chair of CYP committee, I spent a year chairing the SEND review that took place during my time in office. And amongst several important recommendations, we recognised the need for a new orchard school, which I was very proud to commission and set in train. But also I remember we recommended that we would need to find a site for at least one more new special school. And I note that on page 42, section 2 of the report of the policy, members' approval will be sought to build new specialist provision in the Hucknall or Ollerton area. And well, I can remember meeting with officers at the tail end of my chairmanship to discuss this. So as we can see, as with the Orchard School, these things do take time, and often they go over from one administration to another. I wouldn't say that this needs to be an either or situation, and obviously I don't have the expertise on pupil place in these areas that our officers have, but I think certainly from the understanding I have of the rising numbers of children with significant special needs, and Councillor Owen referred to that, I think there may be a need to look for sites in both of those areas, perhaps not building two special schools simultaneously, but maybe we will need a further one in the future. But we're asking for approval for one of those sites at this time. But as I say, this discussion has been going on for some considerable time now, but we certainly support that. There's the need for increased provision, particularly, I think, in the area of autism, high-level autism, children who are high up on the autism spectrum. I don't think there's sufficient specialist provision at the present time, and so this will perhaps address that. I mentioned funding, and Councillor Owen has mentioned funding, and I welcome the reference that Councillor Owen made to his meeting with the then Minister. We certainly supported him in doing that, and we're pleased to hear about the increased funding that Nottinghamshire has received. But as Councillor Owen has already pointed out, we are there still at the bottom of the league table, and this really should not be the case. The needs of children with special needs and disabilities should not be in that hackneyed phrase, a postcode lottery. And I'm afraid at the moment it is. It's very much as to where you live, whether it's in Nottinghamshire or in a much higher funded authority, as to the level of support that you might be able to access. And that's totally unacceptable. So we would certainly back Councillor Owen and our local MPs in trying to address what is still a significant funding gap. With that, we, as I say, support the report, the principles, and the 12 stated outcomes that are listed there under the heading where we want to be in 3 years' time. And I'm certain that the next Labour chair of the CYP committee will be able to ensure that those 12 outcomes are realised in due course.
Oh, I expect you'll be done long before then, John. So can I now call David Martin to speak? David.
Thank you, Chair. Thank you, Councillor Ryan, for your assessment, and Councillor Peck, and I fully concur with both of you, really. In Ashfield, obviously, we have quite a lot of high rate of autism, as the rest of the county does. So provision and funding would be high on my agenda, because we're actually doing some children a disservice by not chasing that funding as much as we possibly can. I've got residents in Skegby who've got a child with severe ADHD and all those issues, and they have really struggled to get their child into a special educational needs centre. In fact, the school covers keeping him there because they get extra funding for it, and that's part of the problem, because they're trapped in that cycle then, where the school gets allocated higher funding for that child, and yet it doesn't always get the educational need that it requires. So the policy has to be going forward. I mean, this is great. I gave it to one of my colleagues who's got a child with autism, and he read it and he fully agrees with the whole policy. So I've got no issues with the policy, but what I have got issues with is, yet again, Nottinghamshire is being let down by the government funding, which is clearly we have a requirement and a strategy for, and that's where we need to be focusing our efforts.
Thank you. I now have Kate Fole.
Thank you, Chair. I think it's a really good policy, and thanks to officers for putting the work in. It's clearly got all the right values and all the right focus there, and I think it's good. It's just kind of what happens in practice, I think, doesn't it? One thing that leapt out at me is a couple of things. One is, in terms of the responses, this is on page 46 or page 2 of the responses. In terms of values and principles question, about 2/3 of the way down, some of the responses have said that accountability, particularly for educational settings that are results focused, and that to me gets the nub of the problem. I don't think we're getting it right always in schools in terms of provision for SEND children, and that's not a criticism of school teachers or what's going on in schools, but I think I'm just not convinced that we're measuring the right things for our very high level SEND children. And of course, all the league tables, all those kind of things make it difficult for schools to get that balance right. I mean, I've sat on, over the many years I've been a governor, an awful lot of permanent exclusion panels, and to be honest, trying to think back, I can't think of one where the child or the student didn't have a special education need or disability of some kind. So I think there's an issue there in terms of what we expect of our children more broadly, and again, it's not a criticism of what's going on in schools. I think the other thing that just jumped out at me was this wonderful page that was about where we want to be in 3 years' time. There's some really brilliant stuff in here, and particularly item 5, parents and carers of children and young people with SEND are confident in the decisions that are made and the provisions their children and young people receive, and about decisions being shaped by SEND pupils themselves. I think that's really good stuff. I have to say though, having a good policy is brilliant, and I congratulate officers on it, but how is this actually happening on the ground? And I've certainly not very recently, but certainly in the last 2 or 3 years, had I think 3 instances where SEND children have not got the provision that they've needed in their school, and it's been flipping awful. It really has for them. I mean, parents and carers of SEND children and the children themselves are in really difficult positions, and a whole range of kind of expectations out there. And sometimes it is absolutely heartbreaking. Sometimes in some of the cases that I've come across. So I suppose that's one of the things that I would like to continue really this conversation. How is this policy actually working in practice? Thank you.
Thank you, Kate. And I have Muriel and then Glyn. Muriel.
Thank you, Chair. Yes, I mean, clearly it's a very broad, positive, aspirational report. I was a teacher in a comprehensive school before the concept of inclusive programme like this of SEND was introduced, and I know then professionally there was a broad commitment to youngsters being included in mainstream education as far as possible, and Nottinghamshire was well ahead in that aspiration. But the anxiety at the time, which I think for me still continues an anxiety, is that because behavioural issues present themselves so actively in the classroom, they are likely to draw resources and attention. And that the issues for the girl at the back of the class, the girl who hardly comes to school, where there might be encouragements for home education, the girl who is academically bright but full of anxiety, those needs are more difficult to meet, I think. And the point on page 41 about our approach to social, emotional and mental health concerns are consistent. I'm not sure what that means really, and from the people I'm supporting at the moment in my district, it just seems that the school's resources are very stretched to provide support to folk with emotional difficulties, as is CAMS. So although the kind of pastoral care is there, the resources to ensure that people with mental health issues have all the opportunities for education, who are not classroom ready. For example, somebody I know who's been trying to get, with parental support, trying to get back into classroom over 2 or 3 years, full of anxiety about other children's behaviour. The offer now is that she comes in to the breakout room where children go if they're having behaviour problems in the classroom. It's obviously the least hospitable place for her, because she will be full of anxiety about how those other youngsters are going to behave. So, I mean, I appreciate the difficulties for school in meeting the needs of pupils who are often in a minority and whose needs are quite subtle. I just think we need to be a bit more specific about how we're going to meet those mental health needs. Thank you.
Thank you, Muriel. I now have Glyn, please. Glyn Guilfoyle.
Thank you, Chairman. Chairman, really support this plan. I mean, in one sense, it's a lot of beautiful words which could, if implemented fully, change the lives of a significant number of children within our schools today. My concern is that it's not fast enough. There are insufficient resources there to deal with it. I've seen within primary schools where they've done an absolutely fabulous job with minimal resources to work with youngsters who have had difficulties. And then when they've come into transition through into secondary school, that all that is not there, and that there's a turnaround in the behaviour and everything else, you know, the life chances for that young individual. So for me, I think, and I'd just like it clarifying, because on page 47 of 142 in the yellow pages, in the responses, the 51 that we got and the ones to next steps, the 66, they pulled out very much the drivers that need to be put in place to ensure that this policy achieves what we want it to achieve. So apart from the funding, you know, the issues that people are experiencing in the process of getting an assessment done, whether that assessment, you know, says that your child has got special educational needs or not, just getting that assessment done is sometimes too long in the process, and means that it may not just be an educational plan that they need, it's that other side, the healthcare plan, that isn't done. And I think that we need to make sure that those issues that are outlined there are implemented. And I know it says there that at the bottom in the summary, that both the online consultation emphasised a wide range of issues which need to be addressed for a successful implementation of the policy. And I just wanted the assurance that those, because I think they're key, those key issues have been picked up within the policy and will be implemented. Otherwise, as I say, it's a beautiful set of words, but unfortunately, if it doesn't get adequately resourced, and if some of those essential outcomes and next steps are not in, we're not going to achieve what we need to achieve.
Thank you, Glyn. And I have Tony Harper and then Mike Pringle. Tony Harper.
Working group, a member of the Transitions Reference Group, which deals with the transition from CYP to adult social care, plus the Learning and Development Partnership Board, and governor of a school with a high level of education needs. The CYP have done a lot of hard work on this subject, particularly as Kate mentioned about the article about where we want to be. But as others have said, still concerned about the lack of funding compared with our neighbours, but we are moving in the right direction, and that's a good thing. I fully support this paper. Thank you, Leader.
Thank you, Tony. And now I've got Mike Pringle. Mike.
Thank you, Chairman, and support the paper. It is something which can be followed through. I think the where we want to be in 3 years' time is quite relevant, and although I cautiously applaud the points of direction in whatever is an ever-growing concern, point 9 is very prevalent in that it is in relation to the trigger points that are vulnerable, that are recognised within our vulnerable. And our schools do a fantastic job, there's no question about that. But I think it was Councillor Martin mentioned, there is a trap, a funding trap for students within our schools, which we need to eradicate. So any development which assists this and develops new, I'll take on board, you know, whether it's in Ollerton or whether it's in Hucknall, any new proposal for a new school will be of a huge benefit to those people. And certainly, as Councillor Owen pointed out, that have been let down for so long with inadequate funding. So completely applaud the paper and support it, and cautiously look forward to the results.
Thank you very much. I'm going to ask the Officer President, I think it's Marion who's present here today, to take up some of the points that have been mentioned. I reserve my right to speak as seconding this. I have to say one of the first acts that I made when we took over this administration was to go and find a site for the Orchard School, and also to oversee the refurbishment of the Ashley School in Cotgrave, as both of them very much needed doing. The Orchard School has been opened. It hasn't had its official opening yet, and from all the feedback I've had, it's a great success. I think it's just the sort of thing children do deserve. I do remember very well the argument between everybody in mainstream school, everybody in special schools. I think it is a mixture, and it's for the child's best interest we need to do that. And so every confidence in this paper is going to deliver those things. Philip, before I bring Marion, is there anything you wish to say as you've made the recommendations?
Oh, well, I've never heard so much carping over a policy that's supported by everyone. I find it a little hard to believe. And let's celebrate the fact that we're getting an extra £12 million approximately. That seems to have been forgotten. Councillor Guilfoyle says it's beautiful words. Well, I'm a beautiful person, so you'd expect the words to be beautiful, wouldn't you? I agree with that. For goodness sake, come on now. And Councillor Fole goes on about the policy working in practice. Well, if she reads the report, which I'm sure she has, she will see that there is going to be feedback to the Children and Young People Services Committee, and we shall be monitoring the progress in the implementation of this report, of this policy, for years to come during the life of the policy. I would reiterate, Leader, the comments you've made about the excellent progress we've made in special school provision. I take you back even further. In our last administration, we completely rebuilt Carlton Digby and opened it. You've mentioned the Orchard School, which has opened. I think it was a week late in opening because of building issues, but nevertheless, I've had very positive reports about the way that is operating. You mentioned also Ashley as well, which we've spent an awful lot of money on. We are looking for a site, and we may have a possible site in the Ollerton area. And only at the last committee of Children's Committee, we talked about the consultation on closing Ayrham School because there were no pupils in it, and the possibility that that might be converted into a special needs provision. So this is very much at the forefront of our thinking. We have secured nearly £12 million extra to support the policy, so I think it is something to celebrate. It's a beautiful policy with beautiful words and backed up with a lot more money. What could be better than that, Chairman?
Thank you very much, Philip. Now, Marion, is there anything you would like to add to this debate today? Have we not got Marion on the call?
She's here, so she's not going to mute you. Do you want to say, are you
Yeah, yeah.
And I realise, yes, sorry. Yes, I can answer or respond to a few of the questions that members have asked. The policy, I'll group some of the questions. The policy itself has been written and informed by the actual words and feedback of parents, carers and children and young people. So that is one of the reasons why the policy reads as it does. And we as officers are very positive about that. It has been informed directly by parents with children with special needs, and also by schools and other partners as well. It also builds on the recommendations of the High Needs Review in 2017-18. So again, it speaks to the priorities in Nottinghamshire to meet the needs of children with special educational needs. Nottinghamshire, as Councillor Peck has said, and as Councillor Owen, is an authority where our objective is that children and young people with special educational needs can look forward to a future that is positive, fulfilling, that leads to further training, employment, meaningful relationships and housing in adulthood. That is what drives this policy. And the action plan, which is being finalised with partners in health, and including in Bassett Law, builds on that aspiration, and we need to work together to pool the resources that we have to meet the children's needs. With regard to the support for children with social and emotional needs, this is a priority for all partners, and particularly at this time. We all know that we've had the funding for the wellbeing to return to school, of which our share of the 8 million announcement was 120,000, and that will be used to provide training to and developing mental health leads in all schools, and that training is being led by Education, Learning and Skills, and the training starts on the 11th of October, and we are optimistic that we will have the local offer for social and emotional well-being, our local offer, which is also one of the objectives. We are confident, we think, that that will be in place for Easter, as was originally required, in the guidelines. With regard to the SEND being a priority in schools, whilst Ofsted has been postponed, the new framework places a sharp focus on wider and broader outcomes for children with SEND, and I'm hopeful that with that carrot and stick approach, the motivation of the policy, which we will share with the schools, or which we've already shared with schools, but will increasingly do so with that little bit of the carrot and Ofsted, will help to put the outcomes of children with SEND in sharp focus for all of us. It's a policy that we hope will bring us all together with our education partners in health and social care, as well as in schools and other wider providers, so that children with young people with special needs are prepared for a meaningful and positive adulthood. So I think I've tried to sum up the themes of the questions.
Well, looking at the nods roundabout, Marion, I think you have done just that. I'm now going to move to the vote and ask the Chief Executive to call the vote, please.
Thank you, Chairman. Starting with Councillor Adair.
4.
Councillor Barnfather.
4.
Councillor Butler.
4.
Councillor Cotty.
4.
Councillor Cutts.
4.
Councillor Fole.
4.
Councillor Garner.
4.
Councillor Guilfoyle.
4.
Councillor Greaves.
4.
Councillor Harper.
4.
Councillor Jackson. Councillor Richard Jackson. I'll come back to Richard.
4.
Thank you, Richard. Councillor Knight.
4.
Councillor Lawton.
4.
Councillor Madden.
4.
Councillor Martin.
4.
Councillor Owen.
4.
Councillor Peck.
4.
Councillor Pringle.
4.
Councillor Weiss.
4.
So that's carried unanimously, Chairman.
Thank you very much, Chief Executive. Thank you all very much for a very well-informed debate. I'm now going to move on to agenda item 7. It's a report of the Chairman of the Children and Young People's Committee and approval for Disabled Facilities Grant top-up loan, presential adaptations to a private accommodation. And I'm going to ask Councillor Philip Owen to introduce this as it has been discussed by his committee. Philip.
Thank you very much, Leader. A disabled facilities grant is the mechanism by which district councils fund essential adaptations to private accommodation. The aim is to enable disabled people to live as independently and safely as possible in their own homes, and there are strict criteria as to what such a grant can be used for. The County Council's Children's Occupational Therapy Service assesses the child or young person's need to establish what is necessary and appropriate and offers a top-up scheme to help fund those adaptations which exceed the 30,000 maximum DFG limit. The details of this are set out in the committee paper, but there are a number of details which clearly I cannot report publicly, and I'm sure members will understand that. But the parents of the young person who has severe needs are prepared to take out a loan and to contribute and to make up the difference. And so we are proposing that we have we make the loan of 30,000 to the parents for these adaptations, as you can see in the recommendation. So I move that and urge members to support it. It does seem to me a bizarre arrangement that we have, that a person or a family living in private accommodation has to go to first the district authority, and then they have to come to us as the county council to make additional monies available. Wouldn't it be so much simpler if we had a unitary authority and parents would be spared a lot of the stress that must inevitably occur by having to go through two sets of bureaucracies? But having said that, I move the recommendation.
Thank you. And I'll second those recommendations and reserve the right to speak. Do I have any speakers to this item, please? I haven't had anyone indicate, and therefore I'm going to use my right to speak by saying I entirely agree with you, Councillor Owen. I think parents are under enough stress than going through two hoops when one would have been sufficient. And I hope this work can be done as soon as possible. It's not delayed by this process too long for this child and these parents to access better facilities within their own home. So is there an officer wish to add anything to this report? No, I'm now going to ask the Chief Executive to take this to the vote. Chief Executive.
Thank you, Chairman. Starting with Councillor Adair.
4.
Councillor Barnfather.
4.
Councillor Butler.
4.
Councillor Cotty.
4.
Councillor Cutts. 4. Councillor Fole.
4.
Councillor Garner. Councillor Guilfoyle.
4.
Councillor Greaves.
4.
Councillor Harper.
4.
Councillor Jackson.
4.
Councillor Knight.
4.
Councillor Lawton.
4.
Councillor Madden.
4.
Councillor Martin.
4.
Councillor Owen.
4.
Councillor Peck.
4.
Councillor Pringle.
4.
Councillor Vice.
4.
Can I come back to Councillor Stephen Garner?
4.
Thank you. That's unanimous, Chairman.
Thank you very much. And thank you all for your support on that item. I'm now going to move on to agenda item 8, which is the report of the Modern Slavery and Human Trafficking Statement. I think this is probably one of the most disgraceful and disgusting things which is happening in our country today. And I don't believe that we're discussing modern slavery this day and age, and there is something quite appalling about this. I know we had a lecture from someone who's dealing with this matter altogether, and this is commonly felt across all local authorities, irrespective of their political point of view. We're all at one on this. It has to be stamped down, and it has to be eradicated from our country. And I think it is the powers that be that need to have more to do with this. Now, I am going to ask Councillor Philip Owen if he would propose this, please. Because I'm sorry, I'm proposing it, and I'm ready to second it. I'm proposing it because I do feel very strongly about this. When you have young girls that are trafficked to this country for exploitation and trapped in these awful places and probably become drug addicted as well, when you have young people here who are in sort of various building or ancillary services without there being any proper supervision of where they're sleeping, where they're being housed, I think this is all down to this country. We should all be ashamed of this, and we all need to up our game on this. So I'm going to propose we accept this report. I'm going to ask if I have a seconder, please, Reg.
Yes, I second the report and reserve my right.
Thank you. Right, Councillor Owen, I'm sorry, I've called you too soon.
Yes, thank you, Leader. As members will know, I am a member of the Strategic Migration Partnership, which meets quarterly. It's an arm of the East Midlands Council, and this is an item which we discuss quite regularly, and it really is quite shocking, and it appears in many cases very well organised. I know the representative from Leicestershire talks about Vietnamese in particular arriving in not insignificant numbers on planes into East Midlands Airport, already with mobile phones, and they get out and get away. They on one occasion took a significant number into care, and within 24 hours they had absconded from care, and they're still trying to track them down. And this is absolutely appalling. And I have to say, it does come back, as a number of these things do, to the inadequacies of the border force and border force controls. If this was stopped, if they were stopped actually getting on the planes in the first place and getting in, then this would be so much less of a problem. So I think we do need to be very hard and very robust in tackling these particular issues, but I can assure you, and I can assure members, that it is constantly under review with very, very regular reports of the Strategic Migration Partnership, and our views are fed back directly to the Home Office. Thank you, Leader.
Thank you very much, Philip. Tony Harper, you're the next, and then I have Glyn.
Thank you, Leader. Firstly, I fully support this paper. I have to say I don't like the label modern slavery. In my view, the word modern belittles it. This is slavery in the present world, and it's disgusting that it's going ahead. I've dealt with this in my previous occupation, and personally I don't think enough is being done nationally to combat this hideous crime. In my opinion, it's widespread. Anything we can do to combat this is a bonus. We must put more effort, we must put more work into this nationally. It's got to stop in this present day and age. I fully support this motion. Thank you.
Thank you very much, Tony. I now have Glyn Guilfoyle. Glyn.
Thank you, Chairman. Support the papers before us, and also just a few issues. it is, you know, it's an international organised crime. This right across the world, people are suffering from this heinous crime. It, for me, it's, you know, there was a report in June this year where it says there were 150 people that were recognised as potential victims just in Nottinghamshire alone. Yeah. Within the report, we have got a couple of cases that have been highlighted in areas where selling illicit tobacco and people were being forced to do that. And also later on in the yellow pages at the back of the report, where we carried out an audit and it was regarding two of the supply chains in residential care and nursing home, and further safeguarding work was proposed. And that for me is the key part of this, is that clearly we've seen, you know, nationally in the news where major chain stores who have then found out that their suppliers, who have probably all signed up to these papers that we've got before us, but they've still been found out they've been hoodwinked and been victims sometimes without their knowledge, sometimes possibly they may have been involved, where they've got people who are making goods, who are using people through modern day slavery. And I just want to know how much more we can do on checking, because it's okay that we have a policy, as said earlier, you know, it's okay having the policy and it's okay saying to people, tick the box. What I would want to do is to make sure that we actually are doing some spot checks, like the audit that was carried out on adult social care, to ensure that the people that say that they're complying are complying. And I think the other thing is, again, you know, for the public at large, you know, these things are happening in front of your eyes. Yeah. You know, the person that's going to purchase that illicit tobacco in shops right across Nottinghamshire today, you know, there are people today selling illicit tobacco. The person doing that may be a slave, may be someone who is, you know, not getting paid, having hardly any food, you know, the shoes taken away from them in some cases so they can't run off. So the public at large need to be aware of that. And, you know, so I fully support our publication again of the document, but would want to see that we do some more checks ourselves on whether the people that we're doing business with, you know, are true to these values. Yeah. And also, you know, commend our trading standards officers who are going out there and finding a lot of these cases.
Thank you very much, Glenn. I can only agree with you on that. Mike Pringle, you're next. Mike.
Thank you, Chairman. Most members will be aware that a few years ago, locally we were touched by something that was included within the abuse of people, to be quite honest. And it's a disgraceful act, and for me should carry the highest penal sentence, to be quite. It's complete abuse, no matter how you look at it. So anything which highlights and supports the eradication of this, I completely support.
Thank you, Mike. I now have Kate and then Rachel. Kate.
Oh, thank you, Chairman. Yes, just to say, absolutely support this this statement. I know if Alan was able to join us, he would be. He's very passionate about this, and as you know, he has a local government lead role in all this. And certainly in terms of sharing your concern and disgust, and I think Ben makes a good point, and it's made in here as well. This is all our responsibility, isn't it? We all need to be vigilant. We all need to get concerns out there so people can understand and be aware of what the signs are, so we can get rid of this disgraceful and sort of disgraceful practice. Thank you.
Thank you, Kate. And now I have Rachel and then Richard Butler. Rachel.
Thank you, Chair. Yes, this is, as you say, a modern disgrace, but this has been going on for decades. The people who know me around this area know that I've got some quite strong views on shopping in certain shops because of the trail back to slaves or very low paid workers producing whatever they're selling. I don't eat certain chocolates Have you ever looked at the origins of your chocolate to see if it's harvested by 9-year-olds who have been sold into slavery or who have been stolen from their families by slavers? We can all do individual things. I welcome this public statement. It's only a small step, so I will be supporting it, but I would also call for you all in your own individual lives. You don't have to do it across the board. Just pick one subject, such as chocolate or clothing, and refuse to purchase that. The only way we will stop this is through financial penalties. And if you don't put the money in their wallets, they won't proceed with it. Fair trade. Okay, thank you.
Thank you, Rachel. I think it goes a bit wider than just trade, though, doesn't it? I'm now going to bring in Richard Butler and then Muriel Weiss. Richard.
Thank you, Leader. Well, my points have been made, actually. I was just going to say that in this day and age, it does seem incredible that we're talking about this awful situation. But also the point being that many people, in all innocence, may be contributing to it. So, I mean, that we've heard from colleagues just now about products and so on and so forth. But even things like certain car washes and nail bars, that sort of place. You read and hear that actually the people working there are slaves, and it's a terrible world we're in to have this. So really, yes, just basically fully supporting the report, and hopefully word spreads amongst the general public to be more aware and just think about what they're buying and the services they're buying, etc.
Thank you, Richard. And now Muriel.
As many of you probably know, a previous Nottinghamshire MP, Vernon Coker, has been made honorary professor at the Nottingham University in this department. And his comment is every single victim of modern slavery is one victim too many. So locally we have valiant attitudes towards getting rid of this terrible trade, as you've indicated. Thank you.
Thank you. Do I have any more speakers, please? Reg, you've reserved the right to speak. Would you like to speak?
I haven't got a lot more to add than what's already been added, and I think it's just a scourge of our society that we have to live with this in 2020, and it's not been going on for decades. It's been going on for centuries, and it's still going on, and we're still living with it. And you know, you see it at the docks, you see it everywhere up and down the country, where people are trafficked for one reason or another. And as somebody's just said, it's up to each and every one of us to take a stand against it.
Thank you very much. Can I draw your attention to the fact we do have an anti-slavery day? It's the 18th of October. It's to raise awareness amongst colleagues and stakeholders and partner organisations. And the Nottinghamshire Modern Slavery Partnership, of which this council is a member, will be working across stakeholder organisations to commemorate this day. And such activity is important to all of us to make everyone aware of this. So do I have any comments from any officers in the room? No. I'm now going to ask the Chief Executive, please, to call the register. Chief Executive.
Thank you, Councillor Cutts. Starting with Councillor Adair.
4.
Councillor Barnfather.
4.
Councillor Butler.
4.
Councillor Cotty.
4.
Councillor Cutts.
4.
Councillor Fole.
4.
Councillor Garner.
4.
Councillor Guilfoyle.
4.
Councillor Greaves.
4.
Councillor Harper.
4.
Councillor Jackson.
4.
Councillor Knight.
4.
Councillor Lawton.
4.
Councillor Madden.
4.
Councillor Martin.
4.
Councillor Owen.
4.
Councillor Peck.
4.
Councillor Pringle.
4.
Councillor Weiss.
4.
Thank you, Chair. That's unanimous.
I'm now going to move on to agenda item 9, which is the funding for the future wife case.
Unmute yourself, Kay.
Sorry, think Kay's just come up. Just one moment, colleagues. The chairman's got a technical hitch, which we'll resolve. Talk amongst yourselves.
Well, I'd like to blame the technology. That was entirely my fault. I do apologise. So I'll be honest with you at least. Agenda item 9 is the white paper. I'm now going to ask the chairman of the committee, Chris Barnfather, to introduce this item, please, and propose it. Chris Barnfather.
Yes, thank you, Leader. On the 6th of August of this year, the government introduced a white paper entitled Planning for the Future, which primarily is a consultation which seeks views on each part of a package of proposals for reform of the planning system, specifically in England, to streamline and modernise the planning process, improve outcomes on design and sustainability, reform developer contributions and ensure more land is available for development where it is needed. This consultation covers a package of proposals for reform of the planning system in England, covering plan making, development management, development contributions and other related policy proposals. The last time that there was such a comprehensive proposal in relation to planning was in fact in 1947, when the current legislation, the Town Country Planning Act, was enacted. Since then, some 8 years ago, the government tinkered around the edges with the National Planning Policy Framework, which was a generic guidance rather than something which went into specific detail. There are a number of issues which clearly affect the government and are highlighted within their consultation paper, and these could be summarised as the current system being opaque in process with poor outcomes, too complex, planning decisions being discretionary rather than rules-based. It takes too long to adopt a local plan. Assessments of housing need viability and environmental impacts are too complex and vague. It has lost public trust. It is based on 20th century technology, and the process for negotiating developer contributions to affordable housing and infrastructure is complex, protracted and unclear, and there is not enough focus on design and incentive for high quality homes and places, and quite simply it does not lead to enough homes being built. So the white paper, which allows for 12 weeks for consultation, and of course Nottinghamshire County Council is a statutory consultee, makes a number of proposals and asks a significant number of questions surrounding those proposals. The appendix, which has been circulated to all members, is the County Council's proposed response to this consultation. I should point out that, of course, the County Council has a responsibility for minerals and waste, and indeed its own purpose-built properties, but much of this consultation focuses on issues which are primarily the concern of district and borough councils or unitary authorities. So the response has to be taken in that context, that we have responded as the Minerals, Waste and our own planning authority. The recommendation is on page 69. I formally move that recommendation. Thank you, Leader.
Thank you, Chris, and I formally second it and reserve the right to speak. I have been approached by Jim Creamer, Councillor Jim Creamer, who's the Vice Chairman of this committee, to speak today, and I should like to ask Jim now if you're there. Can we bring you in? And would you please say what you need to say? Thank you.
Thank you, Chair, and thank you for allowing me to speak as well. And can I mainly agree with Chris's actually putting together of the response, but it actually doesn't go, in our opinion, quite deep enough. It is quite correct that it's written for London-based authorities in the main and unitary authority secondly, if you like. But what we don't disagree with, particularly as well, is getting rid of the SIL. So, oh, sorry, it's just bleeped. Is actually getting rid of the 106s and putting the SIL. There's not enough explanation of exactly how that will work For people listening at the moment, the SIL, without going into great explanation, you get some money for a project, but it could be spent outside that area. The 106 money is basically you get it for an area and it stays in that area or immediately adjacent to that area, for instance, for parks, etc. So yes, but the SIL also, and the 106, pays for our schools, pays for our roads, etc., etc. It doesn't mention some of the problems we've got. It mentions a lot of the problems, but it doesn't do anything about the land banking. When it comes to the problems that Chris has mentioned, again, it doesn't give clear guidelines. For instance, in how it will be better. It'll be a better design. I forget the words they use. Beautiful design area within the 3 pillars they've set out. So excuse me, there's lots of notes. It's a 60-odd page document, so it does take a lot of time. And I would actually make a complaint, which is not a general complaint, is that it really is not enough time. As Chris quite rightly said, 1947 was the last time this was actually done in any kind of major way. So 12 weeks for this kind of consultation, it really is just not enough. It's pushing it through. When it comes to what Chris has said about the moving into the 20th, moving out of the 21st century in design, well, we're slowly doing that anyway between the districts and ourselves. It's going more and more online, responses, consultations, etc., etc. So it's something we're already doing. And it does make specific reference to 20th century, but 20th century technology got us to the moon, created the nuclear age, whether you agree with that or not. So it's put lots of platitudes in. As your previous debate, there's lots of words in it, but in actual fact, there's not that many solutions. Let me have a quick look, very short. When it goes in box 7, it's got the biodiversity net gain. Yes, nobody can disagree with that, but there's no mention of it actually going through the biodiversity gain duty in planning, which is going through the Environment Committee at government at the moment. So there's no mention of that, which will actually address that issue, biodiversity, directly. Item 8, the legal duty to cooperate with other planning authorities. Now that is a real worry. Again, it doesn't say how specifically, it's got ideas, but it doesn't say how specifically we would cooperate. And whether a unitary or district council doesn't really matter in some respects, in the respect we've always got boundaries with somebody else. We've got boundaries with the city, which is a unitary. We'll have boundaries, whatever happens. And it does worry me extremely that the duty to cooperate is being removed. Now, that's something that your government did bring in. It causes a pain in planning issues, but in actual fact, it's a very good thing. It might slow it down a bit, but it gets it right in the end. And that's another issue. Is the planning process may be slow, and it says without evidence that people have lost trust in it. They've lost patience with it rather than trust, because it takes a while to get things right. And this could actually push things through against the local community. And if we're going to the local community, it's going to go online and there's going to be more consultation. And it quotes in there, moving away from notices on lampposts. Well, not everybody has actually got the ability to go online, the technology to go online and actually do these consultations. And the worry with that is those with the loudest voices, and given what I've already said about SIL, will actually decide where that money goes. That's not always the people that need it. So again, it comes back to that worry. Oh yes, and the actual line, I've actually gone online. They've created a new body, consultancy council, the Land Tech and Consultancy Council. I forget the name quite right. That was only created in November 4th specifically, in 2019, under the Housing Minister, McVeigh. So that was actually only just created, and they're going to use a thing called Landhawk for the actual mapping and the guidance and technology. And I've tried to log on that several times. I've registered with it, but there's no register, there's no land anywhere on it. It doesn't seem to be a working site at the moment. And given technology, how quick this is, and the technology doesn't seem to be in place yet, again, that's a worry. The use of technology, I've just mentioned that. Change the way development contributions, I've mentioned that as well. It is a real worry. But the paper itself, I mean, we have responded it correctly as a county council authority within hours. But just as a county council, there's no specific mention in there. Within the consultation, it will speed up things to weeks and months. Well, there's no mention at all of actually rights of way. To extinguish a footpath or extinguish a road, it does take time, and there's no consultation on how to actually do that. And every one of us, I'm pretty sure anyway, has got a path someplace going through an estate that needs extinguishing, that the people are complaining about because it now goes nowhere, and that takes time, and there's no mention of that. So it's got certain errors in it. It's got certain bits that we should have addressed as a county council, but nevertheless, I would actually thank the officers and the work that's gone into this. It's a very short time to do a very complicated action response. So I thank everybody for doing it, but I think we could have gone just that little bit deeper, especially as particularly earlier on, Owen was on about, wouldn't it be easier with a unitary authority? We should have asked it, gone into slightly more detail from both sides, what we are now and what we could become. So apart from that, it's a reasonably good document. There's nothing I could complain about the actual wording in it. It just doesn't seem to go deep enough. So thank you for that, Kay. I appreciate the opportunity to speak.
Thank you, Jim. Nice to see you as well. Can I tell you, Rachel, I have got your hand. I know you don't have it on the toolbar, but you are in the list. The next speaker I've got is Tony Harper and then Richard Butler. So, Tony.
Thank you, Leader. Firstly, I support this paper, including our own response, which I like, and obviously a lot of hard work's gone into it. Last week, I chaired the Greater Nottingham Joint Planning Advisory Board. All the member authorities were present, both officers and elected members. We had a detailed presentation on the subject, which is a massive subject, and there was widespread agreement that the Joint Planning Advisory Board jointly responds to the government, together with some authorities, including our own, also responding in their own right, and that's the correct way to do it. There was a general widespread agreement on the white paper, including many reservations, all of which have been mentioned already. But I fully support this motion and thank you for the hard work that's gone into it.
Thank you, Tony. Richard Butler.
Thank you, Leader. Well, the whole world of planning is a big issue, whatever sort of authority is looking at it, and it has to be said that changes are needed. The way it works at the moment has been around for, well, as we've heard, for so many years. Something's got to happen. One of the when you put yourself in the position of the public and businesses out there, there is still a lot of confusion as to which authority, which council deals with different types of planning applications, and so hopefully there is going to be some clarity in that respect as we move forward. I was pleased to see that although we live in a very digital world now and everything so much being online and all the rest of it, I was pleased to see that there are no proposals to do away with the good old-fashioned way of notifying people of planning applications, because I'm sure that we've all experienced situations where a resident or a member of the public has come up to us and said, "Oh, I didn't know there was a planning application for such and such a whatever the application is." And of course, one of the best ways of letting people know about these is one of the old-fashioned ways, and that is putting a notice on a lamppost or on the fence outside. And in this day and age, it would be very tempting for the authorities to do away with such a quaint old idea. But I'm pleased to see that that will remain, as well as the obviously the increasing digitalisation and web presence and all the rest of it. Talking of web presence, there's a lot of talk about expanding that, and that's good. But as ever, I think a word of caution needs to come in with regards to systems and compatibility. We mustn't get into, when I say we, the system mustn't get into a situation where, oh, well, it's already, you can see this on the website, but you have to have X, Y, Z type of system to be able to look at it and all the rest of it. So because we don't want to accidentally prevent people from being able to have a say and a contribution to planning applications and consultations. Finally, I think the issue of SIL and S106, yes, that both are very precious to us as a council, to other councils, and also to all other service providers who are affected one way or another by especially large developments. And but again, something needs to be done with it, because it's down to the confusion thing again. I think I've lost count of the number of perhaps courses and notes I've read about how SIL works and how 106 works, but it's still sometimes quite hard to explain it in a day-to-day layman's way as to how this works and how to ensure that contributions for infrastructure are firstly there, but also to make sure that they're actually asked for. And again, this confusing world of planning we have, when we've seen in the past that perhaps opportunities have been missed for funding and investment to come in to cope with whatever is being planned. Well, and finally, another a word of caution. There's talk about automatic online outline permission being given for areas that are identified for growth. Well, yes, that's fine, but at the same time, even areas identified for growth will come to a limit. You won't be able to keep expanding them forever. Otherwise, where do you stop? So I think it's very important that we have the point in there that is recognised, and that we don't fall into a possible situation of going over the top with areas that have been identified, but will just continue with more and more applications. There needs to be a system in there to keep a lid on that, and I think from what I read, that has been accepted.
Thank you, Richard. I now have Kate, and then Rachel, and then Mike Pringle, and finally John Peck. Kate.
Yeah, thank you, Chairman, and thank you for letting Jim speak. That was very helpful, because as you can see, he's our planning expert, so that was really helpful, because I'm certainly not a planning expert. I just wanted to make two general points where I have concerns about this report. And I am aware as well that actually what we're voting on here is actually the consultation responses and not the white paper. But of course, the two are quite closely linked together. And I'm very concerned, and I know this is cross-party and national concern, is that that there's a real concern that local decision making is being taken away here. And I think that's a real concern. And for me, there is not enough emphasis on that in these consultation responses. So that's my first concern. The second is, again, local reorganisation is popping up as a solution to everything that's going wrong. And that's a case that really we've not accepted yet. You've really not convinced us on that one yet. And I don't think that it really is going to solve all our problems. And at the moment, it doesn't look as unlikely to happen in the near future anyway, does it? So this constant plugging away at local government reorganisation as a solution to every ill is really not working for us. But having said that, thank you for officers. It's clearly very detailed. It's very knowledgeable. I have to admit, I certainly agree with Richard Butler. A little bit more plain language, not in terms of the consultation response, but in terms of planning language more generally, will be very welcome for people like me that aren't heavily involved in it. So thank you.
Thank you, Kate. And now Rachel.
Thank you, Chair. I won't go on too long because the previous speakers have raised the points I was going to in just as much detail. But I will say, Chris, yes, take on board that this is a county-wide thing with the minerals and the waste disposal, etc. plan are more our area than perhaps housing or things like this. But even so, I would take up what Jim has said, in that there isn't enough detail within this for such things as consulting with neighbouring authorities, Section 106, the infrastructure side of things. You look at the Topwigay Farm development, what Section 106 is Ashfield District Council going to have, given that the border goes down the middle of the entrance to that project? The infrastructure there, what input did others have on the infrastructure impact on Hucknall, etc., etc. So I could go through each point, if I wanted to be here for an hour and bring up local items that would actually be dealt with under the remit of this response to the consultation. I'm aware, as being on planning at district, that we have gone into this, and I agree that not enough time has been given to respond to this consultation. There's various things involved in there. I object to the government's tone that local authorities are rubbish at doing planning. Others who wear district council hats, like myself, on their planning committees will know that we get on with it as quick as we possibly can. But there are local restrictions that may hold up decision making. We have, of course, covered this in our ADC response. But also on top of that, I have in my division at least one area that has been given planning permission for a good, sympathetic development that has been left derelict for nearly 20 years and is only now starting to be dealt with. Now, the best one in the world, we can't say the developers are under a housing depression or anything like this, because in Ashfield, as soon as a new development comes online, we have houses being bought up left, right and centre. So to start shouting at the local development committee, the local plan committee, the planning committee, etc., to me is sending the wrong message. I would rather we had a bit more pressure put on the developers to actually get on with what they want to do and not sit on land that is only there to benefit their pockets as house prices go up and up and up. Thank you, Chair.
Well, thank you, Rachel. Can I remind members we're actually debating that the draft response to the white paper on planning reform be approved, not the ills of the present planning system, which of course, if we had one unitary authority for Nottinghamshire, it would rub out all these anomalies of who's which side of the border, wouldn't it? So now the next speaker I have is Mike Pringle and then John Peck. Mike.
Thank you, Chairman. Thank you, Councillor Barnfather, for presenting the paper, and Councillor Creamer for his words. To me, anything which legally allows the voices of local residents to be silenced and therefore ignores local concerns and objections is wrong. To ignore residents in a drive just simply to recoup the failure of house building over time by the government is shameful. And let's not forget that, you know, that this is not me just dreaming things up. Let's not forget that bulldozing over local concerns is exactly the case. That's pointed out by the Prime Minister during his Johnson Newt statement. Look, if we need change, then it should be inclusive change, and the planning reform and response should be complementary to community concerns and strengthen local opinion and not diminish objection. Thank you.
Thank you very much, Mike. And now John Peck.
Thank you, Chair. Yes, like many fellow councillors, when I was on the District Council, I served on the Planning Committee at Newark Sherwood District Council, and that was an extremely interesting time where I learned a great deal about the complexities of the planning system. I also learned that almost any development of any significance would be opposed by sections of the local community. NIMBYism is rife wherever we are. But coming to the report, I mean, I'm not sure, as Jim and others have pointed out, that we've perhaps gone far enough in some of the responses there. But you're quite right, Chair. We're not debating the white paper. But I understand the ambitions of wanting to build more houses. Now, most of us, I think, recognise that we're not building enough houses across the country fast enough to meet need, particularly in certain areas. So that sort of ambition, in principle, I would support. However, not enough attention has been paid, as Councillor Creamer pointed out, to land banking, and I think Rachel pointed that out as well, and that is a huge concern. And so some of the issues are really predicated upon trying to sort out things like that, people sitting on development land for sometimes years on end. The other issue, again, that's been referred to, and I've got a real concern about this, is whilst I accept the need to build more houses, the balance has got to be struck with the need for local democracy and local input, and the local knowledge of local councillors, and I really have some concerns about what is happening, as I know many others do across all political parties. So I hope these things are ironed out in the white paper. I just lastly want to make some reference to the SIL and Section 106. I was on Nottinghamshire District Council when we approved taking part in adopting SIL, I should say. I think we're probably the first local authority to do so. I didn't really understand fully at the time, I have to say, bringing another layer on top of Section 106, and the white paper does suggest bringing together the two areas. But I have a real concern there. Section 106, it hasn't been mentioned by anybody so far. We understand how important it is for school places, highways, all sorts of local infrastructure things. But as somebody, as many councillors do in Nottinghamshire, as somebody who represents rural villages, where we do get a development, even if we've opposed it, where we do get a significant development, it also brings Section 106 money into the local community, so we're not just talking about education places and highway places and so on. But I have a real fear that we may use that. I know in the villages that I represent, and certainly in the village where I live, we've been extremely reliant over the years for Section 106 money to improve the facilities within our village that otherwise fairly impoverished parish councils with a low precept wouldn't be able to supply. So children's play parks and skate parks and all sorts of things that have been reliant very much on Section 106 money to provide community facilities, and I'd be very worried if that is taken away. So I'll leave it there. I think some of the responses we've made are fine as far as they go, but in some respects I'm not sure I've gone far enough, but that's probably not the officer's fault. It's been a very short timescale. Thank you.
I've got one more speaker, David Martin. This is going to be the last speaker because it's now 12:43. So David Martin.
Yes, thank you, Chair. Yes, I mean, we've obviously debated this at Ashfield at great length, and the reflection that I got from the planning department at Ashfield, the general consensus of opinion from those is that some of the questions and some of the directives in here are quite vague. They do take away choice by local residents of local plans, and we had a fantastic neighbourhood plan process in Selston here.
Look, can I just stop you there, David? Could you speak to the paper which is about the reply and not the woes that any small district council may have with planning? It is on this new organisation, and if you just speak to that, I'd be very grateful.
I am. My planning officers have said that some of the statements in here are quite vague, and so they asked for verification from government ministers and government departments, and the answers were also equally vague and ambiguous, and I think the timescale is quite short, you know, and it clearly shows that this is being rushed through, you know, and it doesn't matter whether we had, in certain cases, it doesn't matter whether we had a unitary authority or a district authority, because the 106 money is still not being equally apportioned, is it? So you know, some of the changes are quite drastic and they don't take into account the 106. And I think we need more time.
Thank you. Right, I'm now going to ask Chris Barnfather I reserve the right to speak. Can I just say, we haven't really debated the replies that have been on this white paper. This is our reply from our officers, which I have read and I can concur with. The other details around this are really for detailed planning matters. This is on the white paper and I'm going to support this. Chris, you now have the right to sum up, please, as a proposer.
Yes, thank you very much, Leader. I thank members for their contribution. I didn't know how much interest this would excite, and I was delighted to see Councillor Creamer actually join the meeting today. Obviously, Jim, as my vice chair on the planning committee, him and I have many conversations about planning matters. We share opinions and on occasions differ, but really welcome your observations, Jim. I think the starting point for this is that this is a strategic paper. It's a paper which we are asked to respond to specific questions on. It's not effectively an invitation for us to design a new planning system from Nottinghamshire County Council. There are a number of proposals in the paper and officers have spent much time and energy in composing responses to those proposals. And indeed, when you go through them in some details, that they've actually gone beyond the simple question that's been asked on many occasions and have added much greater detail, and I thank them for that. I think this is a comprehensive response from Nottinghamshire County Council. Some of the issues that have been raised, I share the concerns. As a member of a district council planning committee, as well as the chair of the county council planning committee, I see, if you like, both sides of the coin. And many of us will have our personal views on how planning matters should be dealt with. But we're responding to a consultation. I'm not necessarily sure that the fault is with planning authorities. In fact, I would oppose that statement that the fault is with planning authorities. There are thousands upon thousands of approved planning permissions in the system at the moment that are being sat upon for whatever reason by applicants, whether that be because of financial constraints, wrong timing or whatever. I know for a fact that the County Council's planning officers have had a 100% return rate in terms of timescales for planning applications over the last 12 months, either statutory time limits or indeed where we have agreed extensions because of insufficient information from applicants. So I do not believe that there is a fault with planning authorities. That does not necessarily mean there is not a fault with the system. I think it's right that all systems should be looked at periodically, and that's what this paper is about. It's actually saying that we can do things to make the system better. Some of these proposals I may agree with, some I may not agree with, but any proposals which actually make the system more streamlined, more user-friendly, more accessible through IT, and perhaps remove some of the anomalies, then that has to be a good thing. I could go through a number of the issues that were raised, but most actually of the answers to the questions that have been raised are in the report which is in front of you. So when we talk about SIL detail and removal of SIL or section 106, that's dealt with in para 22. When we talk about duty to cooperate, that's dealt with in para 7. When we talk about rights of way and biodiversity, it's alluded to in para 20. And I think there were several references made to local input and consultation. And again, it is dealt with in the document. The point that officers from this authority make is that the making the original consultation of a local plan, whatever authority makes that, whether it be unitary authority or under the current two-tier system, that is paramount. If any of these proposals are to be enacted, then the local plan has to be widely responded to by communities, whether that be parish and town councils, whether it be district councils, whether it be members of the public or indeed developers, because that local plan ultimately will form the basis for all future development, as indeed it should now. And I would make the point that not all authorities in Nottinghamshire actually currently have a local plan, despite many, many years of preparation, semi-agreement, partial agreement, ripping up of local plans, and let's start all over again. So I do understand some of the government's frustrations in relation to this. But going back to my starting point, this is a consultation that we are responding to. I think that the way in which officers have prepared this response is as detailed as we can be on the basis of the information we're being asked to respond to, rather than designing our own structure and our own plan. And I would recommend it to members to approve.
Thank you, Chris. And the recommendation is that the draft response to the white paper on planning reform be approved. So I'm now going to ask the Chief Executive, please, to take the vote.
Thank you, Chairman. Starting with Councillor Adair, please.
For.
Councillor Barnfather.